We're very proud. We've had 15,000 members of our organization now be vaccinated over the last 3+ weeks. It's really been an incredible process to watch. But, so often we refer to people working in healthcare today as heroes. But I've often described the people getting the vaccine today, these very heroes, as pioneers. It's been truly amazing. And we've really had very limited complications at this point. Nobody has been hospitalized. And it's really been a very smooth and efficient process. And I'm just incredibly proud of the courage and strength of the people working on the front lines of healthcare who are coming forward and getting the vaccine.
Interesting. So as we just mentioned that nursing homes in Connecticut as well will start to get the vaccine this week. Are you involved in those efforts as well?
We are. Largely in Connecticut, the nursing homes are being administered through the partnerships with CVS and Walgreens.
Okay.
But we at Hartford HealthCare do have several nursing homes under our direct ownership, and we are supporting our nursing homes. So that is moving forward also.
So, Mr. Flax, do you have a sense at all, given what you're doing in your hospital and then some of these nursing homes, what is holding up the process? I know, obviously, it may be different in Connecticut than other states, but there's generally seems to be a frustration with the pace at which this is all moving.
It's difficult for me to speak to what's occurring in other states, but I certainly can speak to Connecticut. And here we've enjoyed a wonderful partnership and a close collaboration throughout this crisis, working with our governor, working with our legislative leadership. And this process has been very well coordinated here in Connecticut. The vaccine is largely distributed through the Department of Public Health. We're doing about 2,000 vaccines per day. And for us, the rate limiting factor as time goes forward is really how much vaccine comes into the state. Our health system, we're built for this. We're now planning to do upwards of 20,000 vaccines a day with the model that we've created with 10 locations throughout the state to do the distribution and do the vaccine. So again, I think in our state with a well-coordinated, tightly integrated process, we're going to be able to do this as the vaccines come into our state.
So what are your expectations, if you have any, in terms of when the broader population will be able to get the vaccine and when you may get close to having them all vaccinated?
Yeah, our allocation task force at the state level, in fact, is meeting today. We're going to be in discussions with the governor over the next 2 days as we look to move beyond 1A and possibly into 1B and 1C. So as time goes forward, again, I think the rate limiting factor becomes how much vaccine comes into the state from the federal distribution. But as it comes into the state, we're built for this. We're ready to do it. And I'm very confident that the coordination across all the health systems in the state are going to work in a very tight fashion to ensure that we can distribute this over the next several months to our broad public.
Yeah, Jeffrey, I mean, we're talking about vaccine distribution, but in the meantime, we have seen, particularly from a national level, we've seen these COVID cases continue to rise, record hospitalizations, record deaths. Connecticut was obviously one of those states that was hard hit early on. I'm curious what you're seeing in your hospitals now, and perhaps even more importantly, what the lessons that have been learned are from the spring. How different is this dynamic in terms of people that do go into the hospital, for example? We've got therapies, as you mentioned, the vaccine rollouts. We also know, for example, intubation is not the right approach necessarily. So what does it look like in terms of treatment and those hospitalizations now versus earlier last year?
Certainly. So, in Connecticut, we've been on the forefront of this crisis. And we've largely been able to manage this crisis through coordination of our health systems across Connecticut, I think, very effectively. And what we're seeing today is generally about a plateau. So we've had hospitalizations at about 75% of where they were at the height of the spring. And it's been that way for a number of weeks. We certainly have some angst about now the post-holiday potential implications, and we're watching that very closely. But we look at leading data. So from a testing standpoint, right now our testing positivity rate is about 6 to 7% over the last 7 days. So that's within reason in terms of what we've been experiencing over the last number of months. But the point I really like to make is, across the country, everyone's looking to go back to normal. Yeah. And everyone says, when do we go back to normal? In healthcare, we're going to be better than normal. And very specifically, the reason why today there's less people having ICU care is because we're better than normal. We have new innovations, and it's making a huge difference in how we're caring for people.
Shepard Smith here. Thanks for watching CNBC on YouTube.